Karen Aguilar with Choices for Parents is going to lead the training tonight, and she put together this wonderful presentation for you all. So, Karen, do you want to get going?
Sure. For those of you who I haven't met in person, nice to meet you. I look forward to seeing you at our training. Carrie, are you going to click for the next slide, or do I have control to do that?
Oh, you know what? Let me pass the control to you.
Or either way, you can do it if you want, or I can do it.
I'll give it to you.
Okay.
So that I'll just have to worry about the answers. How's that?
All right. And I just arrow to the right somehow?
Yeah, up where there's 01, and then there's a left and a right.
Yep. Okay, great. Again, this is Karen Aguilar from Choices for Parents. We are a statewide coalition of right now 19 agencies. We started off around 10 years ago with 6 agencies. And we had always done informal parent-to-parent support and had wanted to do more formal parent-to-parent support, which is where Guide by Your Side comes into place. We collaborated with the Illinois Early Hearing Detection and Intervention Program, as well as Hands and Voices, to bring Guide by Your Side to the state. And we act as, or actually I act as a person who does invoices, payroll type stuff. Our fiscal agent is Annixter Center, so you'll see paychecks coming from Annixter Center. I take care of the grant writing, all of that kind of behind the scenes stuff. So let's start with the pretest. I'm going to go through the pretest questions. I have a story that includes a lot of acronyms and resources. I'll go through them. And then when the webinar is finished, tomorrow I will email Carrie a list of what all the acronyms stand for. So you can take notes, or you can wait for that to come to you via email. And then I'll also be sending you 2 sections from our resource binder called Children and Hearing Loss. One section is the glossary section, and one is the resource section, state resources. The binder isn't ready to go to print yet, but I still want you guys to have those sections in your hand to review and use as a tool in case you need more information. Can everybody hear me okay? Did Beth ever get on?
She's still not on,
okay.
But she is texting or chatting me with her answers, and I told her she could read along, and if she misses too much, she can always hear the recording tomorrow.
Okay, great. So let's start with pretest question 1. If you wanted to find sign language books or videotapes or DVDs, where would you go? A is ISRC, B, IDHHC, C, local bookstore or library, D, all of the above. Go ahead and send your answers into Carrie.
Which is really Ginger.
Go ahead and send your answers into Ginger.
All right, Janice, good. Sonia, good. Carrie, good. Hold on, I got to catch up. That's good. Andrea, Jacqueline, good. Krista, good. And Lisa, good. And let's see. We've got everyone good. Moving on to 2.
All right. What's the difference between an IFSP and an IEP? I'll let you guys read these on your own. Who's giggling?
Anya.
That's good. Krista, good. Janice, good. Sonia, Jacqueline, good. Lisa.
And nobody's calling through Relay, is that right?
Crystal hasn't logged on yet, and if she does,
all right.
They log in.
Okay.
I see Allison just is getting on now, too.
Nope.
And then now she has up.
Carrie. Yeah. Andrea, I got yours.
Did she pick A?
You know. Who am I missing? Carrie. Oh, yeah, I see it. Okay.
We good?
Yes, we are good.
Okay. Choices stands for communication, hearing loss, options, independence, cochlear implants, emotion, sign language. True or false?
Krista, good. Sonia, Lisa, Carrie, good. Janice, Andrea, good. Jacqueline, good. So the only one I don't see is Beth, but I maybe might missed her, so let me scroll up. I don't see Beth yet, so, oh, there she is. We're good.
All right. Name 2 laws that are related to hearing loss.
Sonia and Beth, good. Carrie, Krista, Jacqueline, good. Lisa, good. And I'm waiting for Janice, Andrea. Good, good.
Okay. A parent would want a DTH for their child with hearing loss instead of a DT. True or false?
Andrea, good. Sonia, Carrie, Krista, good. Beth and Janice, good. Jacqueline and Lisa, good. All right, we're okay.
All right. What I'd like to do as I read through the next slides is make this interactive. So I'm going to basically be telling you a story. You'll be reading along with me, and when we hit any acronym or resource, I'd like to open it up for anybody to let me know if they know what the acronym means or what the state resource is, and then we'll talk through it so you guys get to learn this in a story rather than me sitting here and just preaching one by one to you. So, one child's story. The happiest day of my life was the day that I delivered Anna. I felt contractions and we went to our hospital. I was told that Anna would have her hearing tested because of a law in Illinois requiring UNHS. Does anybody know what UNHS means?
Universal Newborn Hearing Screening.
Great. The actual name of the law is not UNHS, okay? This was also the day that I would start to become confused and overwhelmed. This is our story. Is this pace good for everybody?
I would slow it down just a little bit. We do have so far 2 people that I'm aware of that are reading and they can't hear quite yet.
Got it. Okay. The nurse came in to tell me that Anna had failed her newborn hearing screening. The nurse said something about an OAE and ABR. What does OAE stand for, anybody?
Photoacoustical something emissions.
It's hard to remember this stuff. Anybody want to help her?
I think she got it, otoacoustic emissions.
Excellent.
Oh, I did get it? Okay.
Yep. The T is testing at the end, but you don't have to have the testing part in there. ABR.
Auditory brainstem response.
Excellent. We should have a buzzer or something like that. I was given a brochure with Eddie on it. What does Eddie stand for? It's EHDI, not EDHI. I flipped him around in the pretest. Anybody, EHDI?
Early Hearing Detection Intervention?
Excellent. Actually, the National EDDI program is not an actual person sitting at a desk answering the phone. Hello, this is EDDI. Can I help you? It's really 3 agencies at a federal level who have come together. Every state develops their own EDDI program, which means Illinois' EDDI program might not look like any other state's EDDI program. There's an advisory board that's established to advise the state EDDI coordinator on how the program should look. Does anybody know who our state EDDI coordinators are? There are actually 2.
Ginger Mullen.
Ginger Mullen is one. That sounded like Beth. Did you finally get on?
I did.
Excellent. Does anybody know the other one?
I do.
Go for it.
Yes, you, Karen.
Tanner.
Say again?
Gail Tanner.
Exactly. Gail Tanner works at the Illinois Department of Public Health. You guys will probably rarely see her. You'll see a lot more of Ginger. Okay, so I was given a brochure with EDDI on it, and they told me that they had to report the failure to IDPH. Again, IDPH is the Illinois Department of Public Health. Our newborn hearing screening in the law requires that all hospitals report screenings to IDPH. Interestingly, our law in Illinois also names the Department of Human Services, where the Bureau of Early Intervention sits, as well as the Division of Specialized Care for Children. So we have 3 state agencies in our state law for newborn hearing screening. Is everybody confused already? It's confusing. All right. They asked me who my PCP was. Who's PCP?
Primary care provider.
Good. And I told them that at that time I didn't know. They told me to follow up and schedule diagnostics and to call DSCC if I didn't know how to have the cost covered. Anybody remember DSCC?
Division of Specialized Care for Children.
Excellent. In Illinois, DSCC receives funding from a national level filtered through so that they can provide services for parents whose children are medically and financially eligible. Regardless of eligibility, though, they will be the safety net to pay for diagnostics after an infant has failed a newborn hearing screening. We're lucky in Illinois that if a private person doesn't have private insurance, doesn't have all kids, doesn't have a way to pay for diagnostics, DSCC will pay for that. Also, if a family is not medically or financially eligible for services through DSCC, they still have case management services for any child with a disability 0 to 21. This is a program a lot of people don't know about and don't take advantage of. So you'll be getting a lot more information from Ginger at the training about DSCC, but take a minute to read through it, go to their website, and learn more about the services that they offer. It's really a service that's not taken advantage of enough. Questions so far? All right. After we called UIC, U of C, and CMH, and Carl, if we lived a little further south, UIC is what? Some of these are Chicago terms.
University of Illinois, Chicago.
Yep, U of C.
University of Chicago.
Yep, CMH.
Children's Memorial Hospital.
Great. Carl. We chose one and had Anna's hearing tested. They told us that she did not have a hearing loss. I asked if she was deaf or HOH. What does HOH stand for?
Hard of hearing.
Good. I thought maybe we would Q, and she would go to AHI. Does anybody know what AHI stands for?
Alternatives and Education for the Hearing Impaired.
Thanks. Alternatives and Education for the Hearing Impaired. In the northern part of the state, there's one school that cues. Everybody know what cueing is, or should I do a quick fill-in on cueing? Good.
I would do a quick fill-in.
Okay. Cueing uses hand shapes on different part of your face and your neck to show the consonant and sounds of words. It's not sign language. It's hand shapes that is fairly easy to learn. There are cueing translators. They're called translators, not interpreters. And it's not an actual language. Again, it's just hand shapes shown on different part of your face and your neck to show the sounds that a word is making.
Karen?
Yeah.
Did you say translator or transliterator?
Transliterator. Did I say translator? Sorry, transliterator.
Yeah.
Karen, I'm going to interrupt one quick second.
Yep.
Is anyone else having a hard time? I know Beth and Sonia are saying that it sounds garbled and it kind of gets broken up at times. Is anyone else noticing that, or is everyone else okay?
This is Jacqueline. I'm getting a little bit of it.
Okay.
Do you want me to try taking my headset off? Do you think it's me?
I don't know.
I can. Let me try it.
Everyone else is IMing, saying that they're also hearing that too.
Is it better right now?
Gary, I can hear you perfectly. It's Karen who's cutting in and out.
I hear Beth cutting in and out, though.
That's what I hear, too. It's Carrie. I hear you just fine, Karen.
Okay. I'll keep the headset off just in case.
All right.
Good?
If there's difficulties tonight, hopefully the recording will still come out okay, because Karen sounds fine to me as well. And so hopefully the recording will come out okay, and if you want to review it with the recording at a later date, you can. Just let me know. Thanks, Karen.
Sure. Okay. Or we would go to an oral school like CV. Anybody?
Child's Voice.
Child's Voice. In the northern part of the state, there's a private school called Child's Voice. It's an oral school. But maybe we would all learn ASL. Anybody?
It's a sign language.
Thank you. And then use a TTY. Anybody? TTY. Go ahead, Tele. Typewriter. TTY stands for teletypewriter. It's a machine that has a keyboard on it with holes on the top to put a handset into, or you can directly connect it to the wall through a phone line. And before the relay service and all of that came out, this is the way the deaf people would communicate with each other. They would make a call from TTY to TTY, having conversations. Everything that was typed would show up on the other person's screen. Anything the other person typed would show up on your screen, and back and forth. Title IV of the Americans with Disabilities Act, which is a federal law, also establishes the relay service, which means that if I have a TTY and you do not, I call an operator. The operator will voice my message to you and will type your message back to me. Make sense?
Karen, I'm sorry. Now you are sounding garbled. Would you mind trying it without the headset?
Put the headset back on?
Yes, please.
Put it back on, Carrie?
It was off this time?
Yeah, I took it off.
Sorry. Now it's been worse ever since we talked about it.
You tell me what to do. I can take it off or put it on. It's off right now.
If this is what it's been with it off, then put it back on maybe.
Okay, hold on.
Thanks, guys, for being patient. And if it does sound bad, don't feel free.
All right, how does that sound?
Feel free to speak up in the future. It sounds good to me.
All right. VP, does anybody know what a VP is? VP is a video phone. Instead of typing a message back and forth on a TTY, there are relay companies who come to your home and they'll install a camera connected to either a TV or your computer, and you click on a button, it turns on, and you're able to sign to somebody from camera to camera. So I could call Beth and sign to her. If I had a video phone and Beth did not, I would call a relay service. These are interpreters, sign language interpreters, who are sitting in cubicles waiting for calls to come in, and they will sign a message that I am speaking to a deaf person who signs, and the other way around. They'll voice the deaf person signs to me. They're relaying the conversation back and forth. My mind started wandering, and the audiologist told me to take it one step at a time. I wanted to know more about CIs, too. CI? Anybody?
Ugly implant.
Thanks. She referred me to EI.
Early intervention.
Thanks. And the closest CFC?
Child and Family Connections.
Okay. So that a DSC?
Division Specialized Care.
Close?
Designated Service Coordinator.
Yep, Designated Service Coordinator could have Anna evaluated, and then she would write an IFSP.
Individual Family Service Plan.
Correct. Okay. These last couple of sentences, the Bureau of Early Intervention has, throughout the state, Child and Family Connection offices. These are the offices where people work. They're designated service coordinators. And they're designated service coordinators, not a service coordinator, because they've had extra training in hearing loss and vision loss. So all of the families that you're working with should have a DSC, not just a service coordinator working with them. They're the person who case manages the plan for the family. IFSP, the F is for family, which means that these plans are family-centered, whereas an IEP is not family-centered, it's only child-centered. That's a big switch and transition from IFSP to IEP. Questions? Okay. So I met with the DSC, and we decided that a deaf mentor would be a good idea. She also put a DTH on Anna's plan. DTH, anybody?
Developmental therapist of hearing.
Correct. And the families you're working with, you want a DTH on their plan because they're just not a developmental therapist, but a developmental therapist with background and training in hearing loss. I asked what the difference was between a DT and a DTH, and she told me about HVC. Anybody know HVC?
Hearing and vision connection.
Right. It's a state agency that gets their funding from the state. They're housed on ISD's campus, Illinois School for the Deaf campus, and they provide trainings throughout the state to developmental therapists and service coordinators to make them DTHs and DSCs. They do trainings to teach them about hearing loss and the correct way to write plans for families whose children have hearing loss. HVC's staff person, Nancy Scott, who worked there for a number of years, just retired. So they currently don't have a replacement for her to provide trainings throughout the state. They do also have communication bags and communication kits that families can request. It can be sent to them for free, and it has information about how to communicate with your child with hearing loss. It's free, and it's a great resource for your families to also take advantage of. She also told me about choices. What does choices stand for? Nothing. For some reason, right before I was hired, the original group of 6 coalition members decided to call it Choices for Parents, and they put choices all in caps, even though it doesn't stand for anything. Yeah, actually, there was a huge debate because we tried, after I was hired, we had a discussion, and we really didn't like the name Choices for Parents, but we had already started branding the name because we didn't want parents to think that they had to make a choice right away and couldn't change their mind, but we've been stuck with it ever since, unfortunately, or fortunately, I don't know which. Choices for Parents also has 4 or 5 events throughout the year. We have an Eddie Day where we honor people who've gone above and beyond in early hearing detection and intervention. You guys will all get invitations to that. It usually happens in April. This coming year in 2011, it'll probably be moved up to March. We also have a READ event where we receive books from the American Library Association and distribute the books to deaf and hard of hearing children in programs throughout the state to encourage early literacy. We have a binder called Children in Hearing Loss. This is the binder that used to be called Babies in Hearing Loss. It's free to parents. It's in printed form in English and Spanish as well as CD. You'll get information about that at your training. And we also work with the Illinois Deaf Latino Association as well as individuals to teach sign language classes, American Sign Language classes taught in spoken Spanish. So if you ever have a family who wants to learn sign language and they speak Spanish, let me know. Okay, so she also told me about Choices and Guide by Your Side. Whoops, GBYS. Sorry, I figured you guys all knew that one. And Illinois H&V. We assume everybody knows that one. It's Big Ten for Best Canada. Thank you. You guys know that, or should know, that Guide by Your Side is a product of the National Hands and Voices program. When we applied to receive or bring Guide by Your Side to the state, we had to create a pretty in-depth application with letters of support to get approval to bring Guide by Your Side to the state. When we did get approved, we received a manual which was basically a skeleton of what the program could look like. And we spent, at that time it was Beth, Carrie, Ginger, and myself, spent a lot of hours fleshing out the program, how we wanted it to look like in the state. I just want to add one quick kind of pitch here. We did create how the program should look in the state, but we always, always would love feedback. You guys are out there working with families. If you see something with the program that you'd like to see added, changed, tweaked, please let us know. We want this to be an interactive process where everybody is involved, not just the 4 of us deciding what the program should look like and having you guys carry out the program, but knowing in the back of your minds or in the front of your minds that something else would make it a better program. So please always let Carrie know, and she'll bring it to the rest of us so that we can make changes as needed.
Okay. It was hard for me to understand the difference, so she asked that I sign a release because of HIPAA. Does anybody know what HIPAA stands for?
The Health Insurance Portability Act, or Accountability Act.
You got it. Health Insurance Portability and Accountability Act. Anytime you've probably recently gone to your doctor, they've had you sign a release so that they can share medical information. A lot of families who are working with doctors or hospitals or clinics, if you get information from them, they might have been asked to sign a release because of HIPAA and confidentiality. Okay. Any questions so far? Okay. Is my timing better, Carrie? Yes, it is. Excellent. Okay, we lost Carrie. Okay. During one of our first sessions with our DTH, which is Developmental Therapist Hearing, I had many questions. I asked about ISD, which we talked about as Illinois School for the Deaf, and that if Anna had other issues down the road, where would she go to school? We talked about IEPs. What does an IEP stand for?
Individual Education Plan.
Good. Individualized Education Plan. Again, this is a plan that's written for children 3 and up. We talked about IEPs and IDEA. Does anybody know what IDEA stands for?
Is the Illinois, or the Individuals with Disability Education Act?
Correct. Individuals with Disabilities Education Act. Carrie just responded her phone was on mute. Anyway, Individuals with Disabilities Education Act. This is a federal law that plans that. Can everybody hear me okay? It's cracking a little bit now.
Yeah. You're good.
Okay. Individualized with Disabilities Education Act. Again, that's IDEA. It's a federal law that explains education of children with disabilities. I had read something about children and communication, also about behavioral issues in school and at home, and if a child was acting out. She told me about ISRC. Does anybody know what ISRC is?
Illinois Service Resource Center.
Great. Illinois Service Resource Center. They're housed in Northbrook, Illinois, which is in the northern part of the state. They're housed in the Center on Deafness building in Northbrook. And anytime a child in school with hearing loss is starting to exhibit behavioral or emotional disorders or issues, ISRC steps in to help. They have psychologists and counselors on staff, and they go out to the school and they observe the classroom, and they work with the teacher to figure out a management plan, a behavior management plan. They also work with parents in the home to make sure that the transition from school to home is successful and work on behavioral issues. They also do a lot of trainings throughout the state, and it's a statewide organization. Sherry Sinnott is a person you guys will meet hopefully down the road. She's the director of ISRC. I really like going to theater, and I wanted Anna to love theater as well. My DTH told me about ICODA. Anybody know what ICODA is?
International Center of Deafness in the Arts.
Great. International Center on Deafness in the Arts. They're also located in the northern part of the state. They have a theater program for children who are deaf and hard of hearing. It doesn't matter if the child is oral or signs or cues. Everyone is welcome. They do a couple of plays a year where they have children voicing for deaf actors and hearing children voicing for deaf actors. And they have really good shows. It's a really good confidence builder for deaf and hard of hearing kids who might need that time on stage. They also have a teen group that does signing to music and travels throughout the state. Trying to think of when you guys might see them next. Next time I see one of their email alerts, I'll send it to Carrie so you guys can learn more about them. I told her that I was Jewish and my husband was Catholic. She told me about COD and CBS. Anybody know about COD?
The Center on Deafness?
It's also the Center on Deafness. What else is it?
A piece of fish?
What?
A piece of fish?
Cod. In this sentence, it means Catholic Office of the Deaf. The father there is Father Joe Mulcrone. His parents were deaf. He has been around for many years, and he has a church up in the Chicago area. And he does something pretty interesting because he's been around for so long. Doesn't matter what religion you are, he has events at his church. For example, when 9/11 hit and a lot of deaf people weren't able to follow what was going on in the news because there wasn't enough captioning, he called a session for people just to come to the church, and he explained what had happened during 9/11 and after. Anytime there's a huge event in the world, he brings people together and explains what happened for the event in sign language in his church. He also has a very good list of the churches that do have sign language interpreters. So if anyone's looking for a church with interpreters already there, you can contact the Catholic Office for the Deaf. CBS. Does anybody know what CBS is? I'm probably the only Jewish person on the call, right? It's called Congregation B'nai Shalom. It's a temple also in the northern part of the state for deaf and hard of hearing and hearing people as well. They have a choir that signs, and all of their services are in sign language as well. Okay. I told her that I wanted some written information about all of this, and she told me about the Choices binder. And when I asked to talk to another parent, she told me about Guide by Your Side. Okay, moving on. When I first got matched with my PG, does anybody know what a PG is? Keeping my fingers crossed on this one.
Hearing guide.
Thank you. I asked about how this whole, it has to be a little bit easy, right, guys? I asked about how this whole system got started nationally and in Illinois. She told me about the CDC, NCHAM, and HRSA. CDC, anybody?
Centers for Disease Control.
Correct. NCHAM. Okay, the National Center on Hearing Assessment Management. HRSA?
And NCHAM is part of University of Utah, right?
Yes, that's where Carl White is housed. HRSA is the Health Resources and Services Administration. When Ginger talks about DSCC, the Division of Specialized Care for Children, she gets her funding from HRSA. Again, it's the Health Resources and Services Administration. And at the beginning when I talked about there not being a specific EDDI office that you can call at a federal level, these are some of the organizations that came together to form what we call EDDI. A lot of times when you go to conferences, you'll see that it says funding by the CDC. Carl White is the director of NCHAM. He's housed out of Utah. You'll see his name coming around every once in a while as well. I asked if there were group events for families who have children with hearing loss, and she told me about Illinois Hands and Voices. You guys know what Hands and Voices is. During my first session with a deaf mentor, does everybody know what a deaf mentor is? No. Okay, it's an adult who is deaf or hard of hearing who has received training from HVC, which is Hearing and Vision Connections, on how to present different issues and communication modes in an unbiased way. Just because they're a deaf mentor doesn't mean that all deaf mentors are pushing American Sign Language. The job of a deaf mentor is to go into the home and to teach a family about how to raise a child with hearing loss, how to make the home more visual, and most importantly, or very importantly, they're a good role model for the family to show parents who are hearing, whose child has a hearing loss, that a deaf person will grow up and will be okay and will be successful. During my first session, yeah, go ahead.
I'm just going to interject too. It doesn't mean that all deaf mentors are parents of children with a hearing loss. So I don't want that to be a misconception. And then also, just to let you know, Crystal, who's on our team, is also a deaf mentor. There you go.
Thanks. Good. I learned about growing up deaf and IAD. Anybody know IAD? It stands for Illinois Association of the Deaf. At a national level, the National Association of the Deaf is housed out of Washington, D.C. Every state has a state association of the deaf. In Illinois, it's called Illinois Association of the Deaf. They have biannual conferences on the off years that NAD has their conferences. And we're lucky because in Illinois, there is a point person who happens to also be Crystal to focus on children with hearing loss issues. A lot of states don't have that. The National Association of the Deaf can't mandate what every state's program and association looks like. So we're very lucky in Illinois that we have an interest from IAD. We're hoping that we'll start collaborating with them to provide workshops at their conferences for parents and to teach the deaf community more about how to look at a parent who has a deaf or hard of hearing child and raising that child. As a kind of side comment, Carrie and I went to a recent meeting at DSSP, which is Deaf Social Service Providers, and their meetings throughout the state where approximately 50 social service providers come together. And we talked about choices for parents, and then Carrie talked about Guide by Your Side. And we brought the conversation kind of off task a little bit, and we talked to the deaf adults there about how it's very important that they learn how to talk in an unbiased way to parents who have children with hearing loss, especially when parents go to them asking for information about their background and their thoughts. So we're returning in December to do a parent panel. If anyone's up in the Chicago area or would like to come up to the Chicago area, let us know because we're looking for parents to be on that panel. Okay, I asked about sign language interpreters, and she told me about the IDHHC. Anybody?
Illinois Deaf and Hard of Hearing Commission.
Great. The Illinois Deaf and Hard of Hearing Commission is a state agency that represents deaf and hard of hearing issues and concerns at a state level, but also acts as a role model to other state agencies. They're contacted by other state agencies if a state agency doesn't know how to provide interpreter, doesn't know how to provide any type of written communication for a deaf or hard of hearing person. They also testify. They sometimes support legislation, and they're large supporters of Guide by Your Side. She also said that if we were signing to her, we should learn about her rights under the ADA. Anybody? ADA?
Americans with Disability Act?
Yeah. It's the Americans with Disabilities Act. It's a law that was passed 20 years ago, and it has 4 main titles or parts to it. This is the federal law that protects the rights of people with disabilities in employment situations, state and federal, I'm not going to say federal, state and local government. There's a separate law for federal accessibility. Also in public places, so if your child might, when they grow up, need to read captioning, this is the law that protects his or her rights to that. And again, the 4th title or part of this law is what established the relay service. She told me about CHS, CARES, DCI, and CART. I'll open it up for anybody to tell me any of those.
I can tell you about CARES.
Go for it.
It's the Chicago area interpreter referral service?
Yep.
Okay, good.
Anybody else?
CHS is Chicago Hearing Society.
Correct.
DCI is Deaf Communication Innovation, I think.
There you go. Hey, Allie.
Hi.
CART.
I know what CART is. Can't remember what it stands for.
Computer-aided real-time captioning. Okay, CHS, Chicago Hearing Society. They have programs for people who are deaf and hard of hearing. They have an audiology clinic. They have a youth program where they have their ARMED program, which is where deaf and hard of hearing adults go out into the schools where any deaf or hard of hearing child is mainstreamed, and they act as a role model. They will talk to the class about growing up deaf or hard of hearing. They'll talk about what they've done in their career, and they'll be a positive role model for the child who's mainstreamed as well as for the whole class to better understand deafness and hearing loss. They also have an interpreter referral department, and they're also one of the original coalition members of Choices for Parents. CARES is another interpreter referral agency. They don't have as many programs as CHS does. They just have an interpreting department. DCI is the only interpreter referral program that is run all by deaf people. And CART, computer-aided real-time captioning, is captioning. It's very similar to a court reporter connected to a large screen. So if your child grows up and is oral or can't hear at a specific conference, they can request CART to be at that conference, again, covered by the Americans with Disabilities Act. The provider is required to provide that. Okay, and then she told me about EFE and MCLD.
Equip for Equality?
Equip for Equality, good. MCLD?
Midwest Center for Law and the Deafness, or Law and the Deaf.
Very close. EFE is Equip for Equality. At a federal level, money is given to every state to establish a protection and advocacy agency, P&A. And in Illinois, we have an amazing P&A for Protection and Advocacy program, and they've changed their name away from P&A, and they've changed it to EFE, which is Equip for Equality. They've done amazing things in Illinois, and they've become a national model. Their primary goal is to protect the rights of people with disabilities, including hearing loss. This is where a lot of people go to for sitting down and talking to an advocate or an attorney about their rights or any discrimination that might have happened. They are a statewide agency. They currently have a deaf attorney on staff who will be leaving next February. They have a staff interpreter. This is down the road for many people regarding discrimination, but they have a special education clinic that's new. They haven't advertised it yet because they are already so overwhelmed with cases. This is a really good place to talk to if you're working with a family and they're at the due process stage and really need an attorney to get involved. MCLD is a Midwest Center on Law and the Deaf. That's actually my other job, running MCLD. We are an agency that serves 8 states, and we're the only organization in the United States and probably the world that bridges the gap between the deaf and hard of hearing community and the legal community. We train attorneys and judges on what to do when a deaf or hard of hearing person comes into the courtroom. We do workshops for adults and
Turn that down a little.
Say again?
Oh, sorry.
That's okay.
Yelling at my kid.
We do trainings and workshops for deaf and hard of hearing adults and teenagers about their rights under state and federal laws. We also have an attorney referral service where every attorney on a referral list knows what to do when they have a deaf or hard of hearing client come into their office, if it means providing a sign language interpreter or CART or captioning or a listening device. Okay, my deaf mentor told me that if I was going to learn sign language that I had to practice. I thought it would be nice to get videotapes to help us, and she mentioned the IDHHC and ISRC libraries and HBC's communication kits. Remember this one because it was on your pre-test. We already talked about IDHHC, that's the Deaf and Hard of Hearing Commission. They have a library of resources. They have books and videotapes that are on free loan. And ISRC we talked about, they have a library as well, where their library is online. You can make a request, or families can make a request online for books or videotapes or DVDs. And they also send the families return postage, so it costs nothing for the families to get that information. HBC we talked about. Again, that's a statewide agency that trains developmental therapists as well as deaf mentors and providers throughout the state. They have communication kits that can be requested for free as well. Because I also speak Spanish, she told me that I am able to contact Choices and register for one of their sign language classes, taught in Spanish, and also connect with IDLA. Does anybody remember what IDLA is?
Illinois Deaf Latino Association?
Correct. They're also a statewide organization. They're the only one that, again, this is not an agency only for deaf people. It's for hard of hearing people as well. They're the only agency or organization in the state that targets Latino families with hearing loss. They have a lot of good events throughout the year. Their next one is coming up in, I think it's November 19th. It's their annual event. They have awareness days. They have parent panels. And one of their biggest events is the Three Wise Kings event, which is it's kind of like Christmas in Mexico. It happens a little bit the first week in January of every year, and it's an amazing event because, again, it doesn't matter what communication mode or technical device a child is using. All these families come together because Spanish and the Latino culture is their common ground. Again, these events are open to everybody. Okay. I realize, though, that I can learn a lot and maybe get involved. There's always the option of joining the LIC or even the collaborative that is working on quality improvement through the niche queue. Does anybody know what LIC is? It's the local interagency council. This is the advisory board that advises the CFCs, the Child and Family Connections offices. It's a great way to get involved with the CFC. It's a great way to be a part of the system. And niche queue. Anybody know what niche queue is? Carrie?
National Initiative for Children's Healthcare Quality.
Excellent. Ginger is working with different hospitals, birthing hospitals, as well as parents to work on quality improvement throughout the state. They target small change with a system to hopefully improve loss to follow-up. Okay, any questions? Okay. Thank you, Allie, for your comment. The musical for ICOTA this year, or this session, whatever, is West Side Story. And they also have a fundraiser coming up. It's in a couple of weeks on a Tuesday. I can't remember what the date is, but I can get that information to you guys if you want. Also, Equip for Equality is having an event. No, you know what, ICODAS is on a Saturday. Equip for Equalities is on a Tuesday. This year I can email that information to you guys as well. They're honoring Marley Matlin this year as well as, what's that show, Move That Bus? Home Decorator. What's it called?
It's that home improvement show, but I can't remember what it's called.
Extreme Makeover. That's it. See how much TV we watch. It's the Extreme Makeover Home Edition that they're honoring, as well as Marley Matlin at their event. So I will email that information to Carrie so that you know about the ICODA event and West Side Story, as well as Equip for Equality's event. All right, that was a mouthful. Does anybody have questions about any of the organizations that I mentioned or any of the acronyms?
No, that's a great story, Karen.
Thanks. It's all true. No, I'm kidding. All right, let's move on to the post-test.
Remember to send your answers to Ginger privately.
Whoops, sorry. I didn't realize there was one more. As you know, there's a lot of information. Can truly be overwhelming. I'm fortunate, though, that I have a wonderful support system in place. If I forget any of this information, I'm always able to ask someone or look at the information in my binder, which is the choices binder. My PG is always there for me, which is a huge relief, which is so true. All right. Number one, if you wanted to find sign language books or videotapes, DVDs, where would you go? Do we talk about any of these, Carrie, or do they just answer and then I don't?
They're chatting them to me. Janice, Sonia, and Carrie, good.
Do you want me to say the answer or no?
No, because the recording.
Oh.
That's why we have to chat. Beth, Lisa, Krista, good. We don't want to give those recorded people
a leg up.
Yeah. Let's see. Allie, Jacqueline, and Andrea, good.
Okay, now do I say the answer or I still don't say it?
Still don't say it. If they get it wrong, I will message back.
All right.
And we're ready to move on to the next one.
What's the difference between an IFSP and an IEP? You're not allowed to answer A this time around.
Beth, Andrea, Janice, good. Carrie, Lisa, Sonia, good. Allie and Jacqueline, good. And Krista, good. We are ready to move on.
Choices stands for blah, blah, blah.
Andrea, Beth, Krista, good. Sonia, Lisa, Carrie, good. Janice, Allie, Jacqueline, good. And, all right. Give me a second here. All right, you can move on.
2 laws that are related to hearing loss.
Beth, Lisa, Janice, good. Holy smokes. Carrie, Allie, Andrea. Okay, Sonia, yes. Krista. Jacqueline. And let's see. Give me a minute. Hi. One more minute and we're ready to move on. All right, number 5.
Perfect timing. It's exactly 10 o'clock. A parent would want a DTH for their child with hearing loss instead of a DT. True or false?
Andrea, Sonia, Lisa. Beth, Carrie, Krista. All right. Janice, Jacqueline. Okay, everyone's good. Good. Karen, can you move back to question 1 and 2? I'm missing, and I can't, you're going to shoot me. Sina, is that how you say your name? I'm so bad at that. Karen,
Yeah.
Is that how you say your name?
Sinai.
Sinai. Okay, sorry. Thank
Yes.
you. I did not get an answer for you from 1 and 2, so could you message those to me?
Yes, I will.
And everyone else, you are good. You can go get in your pajamas if you're not already and have a good night. Thank you for joining us for the call. Okay, Sinai, that is perfect for number 1. Karen, you want to flip to number 2? Thank you.
Sure. Thanks, everybody. Have a good night.
And thank you, Karen, for doing this for us tonight. It was a great, great way to learn about all the acronyms.
My pleasure.
Yeah, it was great, Karen.
Thanks, Beth. I haven't heard from you in a while.
Oh. Thanks.
Sinai, that's perfect. Thank you.
Okay.
And Karen, can you, just go to 3. I'm going to message you real quickly. All right, I think we're good. Sinai, are you okay with did you get the whole or most of the presentation then, or did you want me to send you the recording?
Yeah, I would like to get the whole recording because, I missed like the first part of it.
Okay, perfect, perfect. Otherwise, everyone is good to go. Thank you so much again, and thanks, Karen, okay?
No problem.
Allie, you know what, let me message you. What question was it on? Was it 4?
Do you want me to stay on, Carrie?
Yeah, you know what, let me switch back the hosting to me so that if you leave, I can shut down the operation. Allie, are you still there? Maybe not. All right. Well, we're good. Thanks again, Karen. It was great.
No problem. You know the answers to all of these, or do you need me to go over any of them?
I got the answers, and I got everyone recorded. It's all good.
Excellent. Thank you.
Thanks.
Have a good night. I'll talk to you later.
You too. Bye.
Bye.